Feeling overwhelmed by NCLEX priorities? You're not alone. Many student nurses feel the same way, especially when faced with the daunting task of preparing for the NCLEX exam. It's completely normal to feel a bit lost or stressed out. You're in the right place. This guide is designed to help you navigate through the complexities of NCLEX prioritization questions and make your study sessions more effective and less stressful. Preparing for the NCLEX can feel like climbing a mountain, right? Each step can seem overwhelming, but with the right strategies and mindset, you can reach the summit. You're bombarded with information, and those pesky prioritization questions can feel like the toughest part. They require you to think critically and make quick decisions, just like you would in a real-life nursing scenario. Don't worry, you're not alone. Many nursing students struggle with these questions, but with practice and the right approach, you can master them. Many nursing students feel the same way. It's a common challenge, but it's also an opportunity to sharpen your skills and become a more competent nurse. These questions are designed to test your critical thinking skills and how you would handle real-life situations as a nurse. They simulate the kind of decisions you'll need to make on the job, ensuring you're prepared for anything. Remember, a nurse's job is all about making important decisions to keep patients safe and provide the best care possible. Your ability to prioritize tasks effectively can make a significant difference in patient outcomes. This guide will break down common NCLEX prioritization strategies in a way that's easy to understand. We'll cover key concepts, tips, and techniques that will help you tackle these questions with confidence. We'll look at examples and practice questions together. By working through these examples, you'll gain a better understanding of how to approach prioritization questions and improve your test-taking skills. By the end of this guide, you'll feel more confident and prepared to tackle those NCLEX prioritization questions head-on. You'll have the tools and knowledge you need to succeed, so take a deep breath, grab your study materials, and let's dive in. Together, we'll conquer the NCLEX and set you on the path to becoming a successful nurse. Why are prioritization questions such a big deal on the NCLEX, you ask? Well, let's dive into it. Imagine yourself as a nurse in a bustling hospital environment. The hallways are filled with activity, and the air is thick with urgency. You have multiple patients under your care, each presenting with their own unique set of needs and challenges. Some patients might require immediate attention due to critical conditions, while others are stable and can afford to wait a little longer. This is where the skill of prioritization becomes crucial. It's not just about who needs help, but who needs it the most urgently. You need to quickly assess the situation and determine who requires your immediate intervention. Is it the patient with chest pain or the one with a minor injury? Who can wait a few minutes without their condition worsening? These decisions can be the difference between life and death. What tasks are absolutely essential to do first? Is it administering medication or perhaps checking vital signs? The NCLEX wants to ensure that you can think on your feet and make these tough decisions in a snap. It's about being prepared for real-life scenarios. Don't worry, we'll provide you with the tools and strategies you need to excel in these situations. You'll learn how to prioritize effectively. Remember, it's not just about memorizing facts and figures. It's about applying your knowledge and critical thinking skills to real-life scenarios. You'll need to use your clinical judgment to make the best decisions for your patients. This is what makes a great nurse. Ready to learn some strategies? Let's go. Together, we'll tackle these prioritization questions and ensure you're prepared for the NCLEX. Let's start with the most crucial strategy, ABCs. It stands for airway, breathing, and circulation. This is your go-to for any question where a patient's immediate survival is at stake. Think of it like this. Without a clear airway, breathing, and circulation, nothing else matters. Here's the breakdown. Airway. Can the patient breathe without obstruction? Breathing. Are they breathing effectively? Look for signs like respiratory rate and effort. Circulation. Is their heart pumping effectively to deliver oxygen? Check their pulse and blood pressure. Always prioritize situations where any of these are compromised. For example, a patient struggling to breathe takes priority over a patient with a sprained ankle. Remember Maslow's hierarchy of needs from psychology class? Well, it's a lifesaver for NCLEX prioritization too. This pyramid ranks human needs from the most basic survival to the most complex self-actualization. Here's how it applies to nursing. 1. Physiological needs. These are the most important. Think airway, breathing, circulation, food, water, shelter, sleep, etc. 2. Safety and security. Protecting patients from physical and emotional harm. 3. Love and belonging, supporting patients' social and emotional needs. 4. Esteem, helping patients feel good about themselves and their abilities. 5. Self-actualization, encouraging patients to reach their full potential. When prioritizing, address the most basic needs first. A patient struggling to breathe takes precedence over a patient feeling lonely, even though both are important. Section 5. The nursing process, your roadmap to success. You're already familiar with the nursing process, ADPI, right? Assessment, diagnosis, planning, implementation, and evaluation. Guess what? It's also a fantastic tool for tackling prioritization questions. Assessment, gather all the information first. What are the patient's symptoms, vital signs, medical history, diagnosis? Identify the patient's primary problem. What's the underlying issue? Planning, develop a care plan. What interventions are needed? Implementation, put the plan into action. Evaluation, did the interventions work? Do we need to adjust the plan? Following this systematic approach helps you prioritize tasks and make informed decisions. Remember, assessment always comes first. Section 6. Least restrictive, least invasive, choosing the gentlest path. When faced with multiple options, always choose the least restrictive and least invasive approach that still addresses the patient's needs. Least restrictive. Opt for interventions that preserve the patient's freedom and autonomy as much as possible. For example, try repositioning a patient before resorting to restraints. Least invasive. Start with basic interventions before jumping to more complex procedures. For instance, try encouraging fluids before starting an IV. This approach minimizes harm and promotes patient comfort and well-being. Section 7. Acute versus chronic, recognizing urgent needs. Understanding the difference between acute and chronic conditions is crucial for prioritization. Acute sudden onset requiring immediate attention. Think heart attack, allergic reaction, or a new injury. Chronic long-term conditions that require ongoing management. Think diabetes, asthma, or arthritis. In general, acute conditions take priority over chronic conditions. A patient experiencing chest pain needs immediate attention compared to a patient with stable chronic pain. Section 8. Practice makes perfect, testing your skills. Let's put these strategies into practice with a sample NCLEX question. Imagine you are on a busy hospital ward, and you have to prioritize your patient's needs effectively. You are caring for 4 patients, each with different and pressing needs. 1. A patient with a new diagnosis of diabetes who needs education on insulin administration. This patient is eager to learn but requires your guidance to manage their condition effectively. 2. A patient 2 days post-operative after hip replacement surgery, reporting pain of 8 out of 10. Pain management is crucial for their recovery and mobility. 3. A patient who had a stroke and is experiencing difficulty swallowing. This patient is at risk for aspiration, which could lead to serious complications. 4. A patient with a urinary tract infection who is complaining of burning with urination. This patient is uncomfortable and needs relief from their symptoms. Which patient should you see first? Think about the ABCs: airway, breathing, and circulation. Prioritizing based on these principles can help you make the best decision. The patient who had a stroke and is experiencing difficulty swallowing is at risk for airway compromise. This is a critical situation that requires immediate attention to prevent further complications. This patient should be seen first. Ensuring their airway is clear and they can swallow safely is paramount. Now try ranking the remaining patients in order of priority using the strategies we discussed. Consider the severity of their conditions and the potential risks if their needs are not addressed promptly. This exercise will help you develop critical thinking skills and improve your ability to prioritize patient care effectively. Section 9. Conquering NCLEX Prioritization. You've got this, you've made it. We've covered a lot of ground, but remember, practice makes perfect. Keep practicing NCLEX-style questions to build your confidence. Don't panic. Take a deep breath and trust your instincts. You've got this. You've worked hard and learned so much. Believe in yourself. Remember, the NCLEX is just one step on your journey to becoming an amazing nurse. Keep learning, keep practicing, and never stop believing in yourself.